So today we're going to show you how to uncover an implant. Usually I want to wait about 4 to 5 months after the surgery or the implant placement for the bone to osseointegrate around the implant. We'll go ahead and use all of the tools and get this uncovered. Obviously this is the first of 3 restorative appointments, so it's the implant uncover. We'll put the healing cap. We do not take any impressions at this appointment. The next appointment, we'll go ahead and take the impression with the coping, so we'll show you how that works, and at that point is when we take the opposing arch and the actual impression, and then the final is the delivery. Obviously we're going to use the screw retain crown if we can, and then we usually use the same implant system. If the patient has gone to an outside oral surgeon or a periodontist, we usually make them cover the cost of the restorative portion of the implant, which is the analog, the healing cap, and the coping.
All right, so then I'm going to come in with my Explorer and just test to make sure that she's feeling them. Any sensitivity there?
No.
No. Okay, so then I'm going to take the 15 blade and we're just going to I usually make a star incision here. So I'll kind of run it mesial distally and then buccal lingually. What that does is it just kind of releases it in all 4 directions so that I can find the implant there, the cover screw. Okay, so once I've done my incision, I'm going to take my Explorer here and I'm going to insert it into the incision here, and I'm going to see if I can get my Explorer or my perio probe to be on the inside of my cover screw, and I can feel that that's inside of my cover screw, so that makes it pretty easy. Now sometimes the implant has been so osseointegrated or is so apical that it's covered with bone. In those rare cases, sometimes I have to use my periosteal elevator to reflect a flap. And worst case scenario, I'll have to get my surgical burr and kind of trough, just kind of like a crown lengthening in a circular form above the implant until I can see the purple head of the cover screw. Then usually when I bring the cover screw out, it might take a little bit of that bone that's been on top of the implant and kind of open it up. In this case, I think that I'm going to be okay without any of that. So what I'll do is I'll next get my screwdriver to bring out the cover screw. So I'm going to use my star wrench here, and I'm going to insert it into my cover screw. And then I can feel it starting to engage. So I'm going to unscrew it until I hear the click. And you can hear the click, meaning that it's all the way out of the threads, okay? Now some of them will come out just like that, but some of them I'll use the periosteal elevator to go in and grab the cover screw. So in this case, I'm just gonna put a little throat pack for the patient, okay? And then I'm just gonna instruct her like I usually do. If anything falls out today, do not swallow it, okay? Falls into your mouth. So then if I press just underneath there, are you doing okay?
Mm-hmm.
I just press underneath there, you can usually get engaged underneath the cover screw, and then the cover screw will pop out. Sometimes it's just tucked under a little bit of that skin, that gum tissue. You can see it coming out. And there it is. Okay, so then I'll go ahead and put in the healing cap. This is a 4.3 millimeter implant, so I'm going to use the 4 millimeter healing cap. So again, go ahead and just for safety purposes, we'll put that throat pack. I've actually swapped out to a shorter star wrench here. And sometimes it takes a little bit to find where that exact insertion angle is. Sometimes rarely, but sometimes you have to draw a little bit of the bone on top of that implant to be able to get that healing cap to stay there. But you want to make sure that that healing cap is above the gum line there. And you're just going to only finger tighten it. You're not going to torque this down. The healing caps are not torqued down. And then you just instruct the patient that they're going to see just a little purple circle in their mouth until we take the impression in a couple of weeks.